Here we'll be discussing what is basically hip replacement all about, and what is navigated hip replacements, and how navigation hip replacements helps for the surgeons as well as for the patients to recover much faster. Yeah, when do you need hip replacement is a very important question. There are lots of patients who are suffering with hip pain. They have difficulty in walking, they have difficulty getting up from a sitting posture, difficulty in climbing stairs. Whenever you have difficulty or stiffness in the hip joint, it's difficult for you to turn on the bed, it's difficult for you to fold your hip joint or sit cross-legged. So it means there is definitely an issue with your hip. So hip replacement basically is needed when your hip joint is totally arthritic or it's totally damaged. This is basically a ball and socket kind of a joint where you have a ball on one end and a socket on the other end. So what happens is usually the ball gets roughened, cup gets roughened. So either of the one, if the ball gets roughened or the cup gets roughened or there is a worn out of the cartilage, it is called as the arthritis of the hip joint. So this arthritis, if it is in stage 4, usually we go for a hip replacement surgery, which is a surgery where we replace the ball as well as the cup of the hip joint. So basically in hip replacement we have got two kind of technologies. One is basically a traditional hip replacement where we do hip replacement with a manual alignment system. So now if you're talking about the navigated hip replacement, is a recent advances or a kind of recent development in hip replacement, which is usually like a GPRS system where if you're driving. So for surgeons it is basically a guided system, which usually is a computer aided guide system which helps you showing the precise location of your implant placement. So this gives an exact precise location of placing the implant, where it improves the alignment of the hip joint, it improves the longevity of your implant, and it also helps in faster recovery for the patient with a minimal excess. It also helps in preventing the dislocations or the failure chances of hip replacements are much lesser when you're using a navigated hip replacement surgery or a navigated device to assist a hip replacement. The recovery period for navigated hip replacements is usually very faster compared to traditional hip replacement systems, because here we do a minimal invasive technology, or the scar is minimal, the healing is much faster in these patients. The kind of mobilization, we usually mobilize much earlier compared to manual patients. So because of the chances of dislocations are much lesser in navigated hip replacements, hence the recovery in these patients is much faster. So any kind of hip replacements, usually the return to activity is mostly within a span of few weeks. We make the patient walk very next day of the surgery. We make sure the patient starts walking with some aid or support for initial few days, and probably once his balance is attained, he is able to walk normally. We'll ask him to walk without any aid or without any support within a span of a few weeks. So he will be able to perform his normal routine activities within a span of 3 to 4 weeks. The modern hip replacement with navigation is very precise, it's safer, it's life-changing for most of the patients.